Thank you very much for inviting me to speak at this important Congress. I've called this talk the WFSA, Uniting and Empowering Anesthesiologists Around the World to Improve Patient Care. And this title comes from the mission of WFSA. Greetings from my country, New Zealand, tēnā koto katoa in the Maori language. I live and work in Christchurch, which is a small city on the east coast of the South Island of New Zealand. Auckland is at the top of the North Island, and that's the biggest city in New Zealand. The capital, Wellington, is at the bottom of the North Island. Greetings also from the World Federation of Societies of Anesthesiologists. This is a photo that was taken earlier this year, which shows the current WFSA board. In the back row, we have Davy Cheng, our treasurer, who is from China, then Mauricio Vasco from Colombia, Walid Habre from Switzerland, who is our director of partnerships, Adrian Geld from the United States, who is the immediate past president. And then in the front row is Daniela Filipescu from Romania, who is our secretary, Amelia Gauch from Spain, then myself, and finally Carolina Haylock Law from Honduras, who is our director of programs. As a member of WFSA, you are part of an amazing global anesthesiology family. WFSA was founded in 1955 in the Netherlands. We currently have 134 member societies worldwide, and we represent anesthesiologists in 145 countries. The reason for the difference between the number of societies and number of countries is that some societies are made up by anesthesiologists from more than one country. And an example of this is the Pacific Society, which has anesthesiologists from 8 Pacific countries. WFSA has an official liaison role with the World Health Organization. And this is important because we can speak on behalf of you all, we can speak on behalf of anesthesiologists all around the world at WHO meetings. WFSA is a unique global alliance. And I like to say that WFSA is its member societies. The strength of WFSA derives from the strength of its member societies. We are a strong voice for anesthesiologists everywhere, whether they work in high-income countries or whether they work in low or middle-income countries. And the basic structure of WFSA is that we have the board, which sets the overall direction of the organisation. Then we have a larger advisory council with representation from all around the world. We then have 13 committees, and these include committees like the Obstetric Anaesthesia Committee and the Paediatric Anaesthesia Committee, the Intensive and Critical Care Medicine Committee, and the Publications Committee. And then we have a small secretariat, which is mostly based in London. WFSA's mission is the title of this talk, Uniting and Empowering Anesthesiologists Around the World to Improve Patient Care. So during this talk, I'm going to talk about the global reality regarding anesthesia and surgical care. I'm then going to talk about WFSA's strategic priorities. Now, some of the material is similar to what I presented last year, but the strategic priorities are new, and they are priorities that have been approved given that we are in this post-COVID era. So firstly, what is the global reality regarding anesthesia and surgical care? It's important first to understand the concept of universal health coverage, and this is an aim of the World Health Organization. So universal health coverage, or UHC, means that all people have access to the health services they need without risk of financial hardship. And it fits with the idea that healthcare is a fundamental human right. And this idea dates back to 1948, when the WHO Constitution was written. But the situation is far from universal health coverage in the world today. And this is a statement from 2015 from the Lancet Commission on Global Surgery, which found that 5 billion out of 7 billion people worldwide do not have access to safe anesthesia and surgical care when needed. The world's population has now increased to 8 billion people. And because of the COVID-19 pandemic, it is likely that the proportion of the world's population that does not have access to safe anesthesia and surgical care has actually dropped. There's a large burden of surgical disease, and one study in 2015 found that surgical disease and trauma makes up 30% of the global burden of disease. The same authors found that surgical conditions and trauma account for 4 times as many deaths per year as HIV/AIDS, tuberculosis, and malaria combined. There's also not enough trained anesthesia professionals. This is work we did in 2015 and 2016 and published in 2017 called the Global Anesthesia Workforce Survey. And we found massive disparities in the anesthesia workforce worldwide. This map shows the density of anesthesiologists, and that's the number of anesthesiologists per 100,000 population. Green corresponds to the more than 20 per 100,000 population. That's the dark green. Red corresponds to less than 1 per 100,000 population, and orange is 1 to 2 per 100,000 population. You can see from this map that there are large areas of Africa, also parts of the Middle East and Asia, that have very, very low numbers of anesthesiologists. After the publication of the Lancet Commission on Global Surgery, we did see some progress. And in 2015, all the member states of the World Health Organization unanimously passed Resolution 68.15. And this resolution was entitled Strengthening Emergency and Essential Surgical Care and Anesthesia as a Component of Universal Health Coverage. So this was a big deal for anesthesia and surgical care because it was the first time that anesthesia had been mentioned in such an explicit way at the World Health Assembly, which is the main decision-making meeting of the World Health Organization. But then, of course, in 2020, COVID-19 happened. And that's had dramatic effects on healthcare worldwide. I'm not going to go into the details, but the main effect of COVID-19 has been to halt progress on universal health coverage. And anesthesia and surgical care have fallen further behind other areas of healthcare. So we've got a lot of catching up to do. So with this in mind, what are WFSA's strategic priorities? In February of this year, the WFSA board got together in London and we held a strategic workshop. We looked at the current situation in the world. We looked at our previous priorities, and then we decided what are the important priorities for the next 5 years. So that's that same photo from before, but we were based in a small manor type home, and we worked through all these over the course of 2 days. So in summary, here are the strategic priorities that we came up with, and these priorities were then approved by Council and have since been circulated to all our member societies. So the first strategic priority is that WFSA will reinforce the vital role of anesthesiologists in global and planetary health. The second priority is that WFSA will strengthen member societies and enhance professional networks. Third, WFSA will advance anesthesiologist leadership in healthcare. Fourth, WFSA will work with member societies to ensure a well-trained and resilient workforce. Fifth, WFSA will improve safety and quality in anesthesiology. Now, I hope that these priorities aren't particularly controversial, but what I'm going to do now is just go through each of these priorities and give just some examples of the work that we're doing in these areas. So the first strategic priority is that WFSA will reinforce the vital role of anesthesiologists in global and planetary health. So for the first time, we're talking about planetary health because there's increasing recognition of the importance of sustainable healthcare practice. So thinking first about global health, we all know that governments and decision makers don't always understand the vital role that we as anesthesiologists play in overall healthcare. The Lancet Commission on Global Surgery in 2015 said that surgery is an indivisible, indispensable part of healthcare. So when we're talking to governments, we're telling them about all the jobs that we do as anesthesiologists and the impact that we have on healthcare. Well, to put it another way, you can't have universal health coverage without safe surgery. You can't have safe surgery without safe anesthesia. So if governments are serious about trying to achieve universal health coverage, they also need to provide adequate resourcing for anesthesia and surgical care. And when we're talking about anesthesia and anesthesiology, we're talking about all the related subspecialty areas of practice, such as pain medicine, intensive and critical care medicine, resuscitation, and as well as perioperative medicine. So we need to remind governments of their commitment, the one that they made in 2015, to strengthen emergency and essential surgical care and anaesthesia as a component of universal health coverage. So in May of this year, we had a delegation at the World Health Assembly in Geneva, and we were arguing strongly for more resourcing for anaesthesia. So the photo on the right shows a statement that I was giving on anaesthesia and the importance of our input into overall healthcare. The second part of this first priority is planetary health, and there's been increasing recognition in the last few years that we can't just look at the patient in front of us. We have to consider the impact of healthcare on the health of our planet. In 2021, WFSA and partners published these guidelines, the Principles of Environmentally Sustainable Anesthesia, a global consensus statement from the World Federation of Societies of Anesthesiologists. I would encourage you to read this statement and think about the impact of your practice on planetary health. The second strategic priority is that WFSA will strengthen member societies and enhance professional networks. As I said before, WFSA is its member societies. We derive our strength from the strength of our member societies. Our vision is universal access to safe anaesthesia. And as I stated before, our mission is to unite and empower anesthesiologists around the world to improve patient care. Earlier this year, we sent out a document with this picture on the front, which outlines many of the benefits for societies and individuals. So for societies, it's the ability to take part in the General Assembly and to be involved with global anesthesia decision-making. For individuals, it's the ability to go on WFSA courses, to apply for scholarships and fellowships. One example of enhancing professional networks is the World Congress of Anesthesiologists. Now, until recently, this was a 4-yearly meeting, and in fact, the last face-to-face meeting was in Hong Kong in 2016. We then had a virtual meeting in 2021. But we made the decision a couple of years ago to change from a 4-yearly World Congress to a 2-yearly World Congress. And the meeting will alternate between a smaller Congress of around 2,000 to 3,000 people to a larger Congress of around 5,000 to 6,000 people. And what's important also is that there will be predictable rotation around 5 regions of the world. So in 2024, in March next year, the World Congress is going to be held in Singapore. And that's in Singapore is in the Southeast Asia, near Australia, New Zealand, and the Pacific region. In 2026, the meeting will be held in the African Middle East region, and the venue for that was recently announced, and it is Morocco. In 2028, the larger meeting will be held in Vancouver, Canada. In 2030, the venue is still to be confirmed, but we will be calling for applications from South Asia, Central Asia, and East Asia. And in 2032, the World Congress will go to Europe. In 2034, it will return to the Southeast Asia, Australia, New Zealand, Pacific region. So we see this as an important way of enhancing professional networks, allowing more anesthesiologists around the world to attend and participate in the World Congress. Strategic Priority 3, WFSA will advance anesthesiologist leadership within healthcare. We saw during the COVID-19 pandemic that anesthesiologists make great leaders, both in the clinical context and the non-clinical context. One way that we can support the development of leaders is the WFSA Fellowship Program. Before the COVID-19 pandemic, we were offering 50 short subspecialty attachments in various centres around the world per year. Unfortunately, COVID put a halt to these fellowships, but we are starting them again, and we're currently offering around 25 to 30 in the coming year. And we offer fellowships in a range of subspecialty practice: intensive and critical care, pediatric anesthesia, obstetric anesthesia, pain management, and so on. One of the key parts of this fellowship program is that we're helping to develop and support leaders and teachers. So it's not just giving the participants knowledge and skills about the specific subspecialty area of practice. This is one of our fellowship programs, the Gunga Hospital Fellowship Program, and I took this photo in 2015. In the centre is Dr. Bala Venkat, who is the program director. With him are Dr. Ahmed from Nigeria and Dr. Nyandwi from Rwanda. Both Dr. Ahmed and Dr. Nyandwi completed the fellowships and have returned to their home hospitals, their home countries, where they are both leaders and teachers in their own hospitals. Strategic Priority 4. WFSA will work with member societies to ensure a well-trained and resilient workforce. We saw on the map before that there are large disparities in the anesthesiologist workforce worldwide. The WFSA doesn't have the resources to train all the people that are required, but we can help member societies to improve training, and also to address some of the wellbeing issues that have become apparent during the COVID-19 pandemic. So here are some examples of working with member societies to ensure a well-trained and resilient workforce. We have helped a number of societies with workforce planning, so in their discussions with government about the workforce that is needed. I've mentioned the fellowship programs, which not only improve subspecialty knowledge and skills, but they support the development of teachers and leaders. We offer scholarships, and this is to allow young anesthesiologists to attend major meetings like the World Congress. We have a range of short educational courses, which I'll mention in a minute. There are a lot of other resources, so a lot of these on the website, and we're working hard to present these resources in a large range of languages. And one thing that we need to also be developing more of is our resources related to well-being, to ensure that the workforce that we have is resilient. One example of an educational resource is Anesthesia Tutorial of the Week. And this year, very excitingly, we celebrated a major milestone where we now have 500 tutorials. On average, these tutorials are produced fortnightly and they're available in a range of language. I know that colleagues in Arkhangelsk have translated many of the tutorials into Russian. The fifth strategic priority is that WFSA will improve safety and quality in anesthesiology. And again, we need to work with member societies to achieve this. One example of how we're trying to ensure better quality delivery of anesthesia is the international standards, which were published in 2018. What's important about these standards is that they have been endorsed by the World Health Organization. So they are the World Health Organization, World Federation of Societies of Anesthesiologists, international standards for a safe practice of anesthesia. And these standards allow anesthesiologists to go to their governments, to go to their decision makers, and let them know about some of the minimum expected standards for the safe provision of anesthesia. Another important way of ensuring improved quality of practice is subspecialty education. And I hope that you're aware of some of these courses. So probably the most well-known one is the Safer Anesthesia from Education course, so SAFE. And the two most well-known courses are the Safe Obstetric Anesthesia course and the Safe Pediatric Anesthesia course. So these courses provide subspecialty training to improve the practice of pediatric and obstetric anesthesia. Another course that I've been very much involved with is the Essential Pain Management Program, EPM. This is a multidisciplinary course, and it really gives healthcare workers a system for better managing patients with pain, and also a system for teaching others about pain management. We have a simulation course called VAST, Vital Anesthesia Simulation Training. And there is a new VAST course which looks specifically at wellbeing issues. And there's another course called Primary Trauma Care, PTC, which WFSA was involved in the development of a couple of decades ago. So, to end, here are the key points. Most of the world's population does not have access to safe anesthesia and surgical care. And the proportion of people lacking access is likely to have gone up as a result of the COVID-19 pandemic. WFSA unites and empowers anesthesiologists worldwide to improve patient care. This is our mission. You are part of an amazing global anesthesiology family, and we can do so much by working together. Advocacy, so telling people about the importance of our specialty, telling people about the importance of sustainable healthcare. Education, short courses supporting leaders and teachers, and collaboration, especially collaboration with our member societies, are key. Just to go over our 5 strategic priorities again for the next 5 years. WFSA will champion the vital role of anesthesiologists in global and planetary health. WFSA will strengthen member societies and enhance professional networks. We will advance anesthesiologist leadership within healthcare. We're going to work with member societies to ensure a well-trained and resilient workforce. And we're going to work with member societies to improve safety and quality in anesthesiology. I hope that some of you, despite all the difficulties in the world today, will be able to get to the World Congress of Anesthesiologists. This is the 18th World Congress. The last face-to-face meeting was in Hong Kong way back in 2016. The 18th World Congress is being held in Singapore on the 3rd to the 7th of March next year. There is no other anesthesiology meeting like the World Congress, and is a chance for people from all over the world to connect, to learn, and to share. Also importantly, next year, we will be having a General Assembly where we will be discussing important constitutional issues and also voting in the new board and the new council. So I really hope to see some of you there. And once again, thank you very much for inviting me to speak at this meeting.